Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the fetal circulation. So under the fetal circulation, first is the presence of, it starts with the deoxygenated blood from the upper part. So there is deoxygenated blood from the upper part. So from the upper part, the deoxygenated blood, it goes to the superior vena cava, that is SVC, and from the superior vena cava, it goes to the right atrium. So let's visualize the right atrium. So right atrium, the left atrium, the left ventricle and the right ventricle. So now what happens is from the right atrium, there are two parts it can move to. So from the right atrium, it either moves on to the left atrium or it can move on to the right ventricle. So what happens is, let's look at the route of the right ventricle. So as soon as it moves on to the right ventricle, it moves to the pulmonary trunk. So when it moves on to the right ventricle, it moves on to the pulmonary trunk. So as it moves on to the pulmonary trunk, there are two paths it can go. So let's look at the first where it goes. First, it can go to the ductus arteriosus. It may lead to go to the ductus arteriosus. Then ultimately it can move on to the descending aorta. So DA and DA. So ductus arteriosus to the descending aorta. So other path is it can move on to the pulmonary trunk. Then after the pulmonary trunk is lungs. So it moves on to the lungs and the pulmonary veins. Next, it again moves on to the left ventricle. So it moves on to the pulmonary trunk, goes to the lungs, the pulmonary veins, and then it moves on to the left atrium. It moves on to the left, not ventricle, it moves on to the left atrium. So now let's continue with the another route of the right atrium. So from the right atrium, we discussed that it can move on to the left ventricle. That's what we discussed. Now again moving on to the other route, that is it moves on to the foramen ovale. From the foramen ovale, it just passes on and then moves on to the left atrium. So right atrium to the left atrium, in between is a foramen ovale. Then from the left atrium, it comes down to the left ventricle. Next, it moves on to the ascending aorta. So from the left atrium, it goes to the left ventricle, it goes to the ascending aorta. From the ascending aorta, it can move on to the coronary circulation and the blood. So coronary circulation, CC, then it goes to the brain as well as the upper limb. Then moving on, it can also go down to the descending aorta and the systemic circulation. Next, from the systemic circulation, it can also move on to the umbilical arteries. So we saw the common connecting point, the pulmonary trunk. Previously we saw from the pulmonary trunk, it goes to the ductus arteriosus. Then again a DA, that is a descending aorta. So this is where it connects. So descending aorta, it later moves on to the systemic circulation. So there is descending aorta. So from the descending aorta, we move on to the systemic circulation. From the systemic circulation, it goes to the umbilical arteries, then moves on to the placenta, then moves on to the left umbilical vein, LUV. So from the LUV, it moves on to the L, that is the liver, and also the V, that is the ductus venosus. So LUV, that is the liver, and V for venosus, the ductus venosus. Next, what happens is from the liver, from the ductus venosus, as well as a deoxygenated blood from the lower part, deox from the lower part. So when these three accumulate, it again goes on to the IVC. So from the IVC, it again the cycle continues, that is it again begins with the right atrium. So now let's quickly recap some important points. So we discussed that from the right atrium, the routes are the right ventricle and it can move on to the foramen ovale. So ultimately this cycle, from the pulmonary trunk, it connects to the left atrium again. And from the left ventricle, it moves on to the descending aorta. The pulmonary trunk, it moves on to the DA and ultimately it leads to the descending aorta. So from the descending aorta, it moves on to the systemic circulation, the umbilical arteries. Then from the placenta, it moves on to the LUV, love, that is the left umbilical vein. So from the left umbilical vein, L stands for the liver and U stands for the ductus venosus. So these two structures. From here, there are three, that is deox from the lower part, the liver and the ductus venosus. So all three combine to the IVC and then it again moves on to the right atrium and the cycle continues. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.